Good evening. Tonight we are going to be doing the cardiovascular and peripheral vascular assessment. We're going to start a cardiovascular assessment with first assessing the patient's skin tone and color. Again, we're with Christy, who is pink, warm, and dry. She has good colorization throughout. In the next part, what we're going to do is we're going to go ahead and do palpation to first find our landmarks for our position. And what we're going to do is we're going to look at the sternal notch in the clavicle, and right below that is on the left side is the second intercostal space, and there I'm going to find the aortic heart sounds. On the right side, directly across in the second intercostal space, we're going to find the pulmonary. On the third intercostal space, we will find the herb point. On the fifth intercostal space, on most women just below the breast, we're going to go ahead and find our tricuspid. And if we go mid-clavicular line in the fifth space itself, we will go ahead and find the apex of the heart. If we look at the chest, the heart itself, we're going to first inspect it. And when we inspect, what we're looking for on the visual exam is we're going to look for any kind of pulsations, and that is, there's no obvious pulsations here. Next, what we're going to do is we're going to check for any kind of vibration. And when we check for vibration, we're going to use the palm of our hands in the same spot. And there is no pulsations noted. At this point, I'm going to auscultate. And when I auscultate, what I'm looking for is high-pitched sounds. And I'm going to use the bell of my stethoscope. And that is normal. And there's no murmur noted. And S2 and S1 are there, but S3 and S4 are absent. I'm going to sit Christy up, and at this point we're going to listen again. The aortic and the pulmonary, and those are normal. So we're going to lay Christy back down, and at this point what we're going to do is we're going to have her turn her neck to the side, and what we can see is that there's no jugular neck distension, and you have to have them at a 30-degree angle, and the carotids are intact. So that would finish our cardiovascular assessment, and at this point what we're going to do is we're going to look at the peripheral assessment. And when we do the peripheral assessment, what we're going to do is we're going to do the temporal, and that's +2. We're going to go ahead and do the carotid, and that's +2. We will do the brachial, the radial, the ulnar, the popliteal, the dorsal pedal, and the posterior tibial. And those are all +2. This concludes our assessment of the cardiovascular and peripheral vascular assessment.